Do you have a mother, father, sister, uncle, or aunt who's homebound and or bedbound and has not been eating very well? This is not an uncommon phenomenon when someone gets older due to disease or other morbidities, that they lose their appetite or are not able to eat. Obviously, when your loved one goes to the hospital, it is almost impossible for them to get adequate nutrition unless they have a feeding tube. Well, what's the one way that you can fix nutrition? This is something you can manage in your own home, and I think you could be successful. I'm Bienstock, and I'm a board-certified plastic and reconstructive surgeon. I help your loved one heal at home, and I teach the family and the caregivers how to really optimize conditions in the home in terms of environment and nutrition. My main focus is on healing wounds in the home, both chronic and acute wounds. So back to the topic in terms of nutrition and how to get your loved one to eat. If they don't have a feeding tube and you really want them to eat, you have to give them foods that they enjoy. When you get older, sometimes your palate changes. I'm going to tell you the story of a 94-year-old man that I took care of in Brooklyn. He wasn't eating, and the wife was very involved and cooked all his favorite foods. And then I told the daughters to change it up. What were some of the foods that he liked as a child? Maybe he'll have some food dishes that his mother used to prepare because it'll remind him of his childhood. So the daughters brought out all the Syrian cookbooks and made him all his favorite, made Syrian food that he liked as a child, and ended up eating all the food, and they learned new recipes, and this really was able to galvanize a whole new nutritional program in terms of getting him to eat, because he started to like food again. They were able to get him protein shakes, they varied his diet, and as a result, he was able to heal his wound, because before he had lost 30 pounds, and after switching up his dishes both at breakfast, lunch, and dinner, he was able to gain the weight back and was able to thrive. These are things you can do in terms of varying dishes that you make and trying to make it more exciting and not give them the same bland food. Even if you have to puree it, you can still make it flavorful. I hope this is helpful, and we'll go over more stories like this in terms of eating and changing palate and making your loved one really thrive in terms of nutritional profile.